Did you know there's pretty good evidence about cannabinoids for wound healing? This new review paper covers 32 studies, so let's check them out. I'm Lex Pelger. I do canna education for CV Sciences, the makers of Plus CBD. It was an excellent line of topicals, including this balm that I used for my hands when they start cracking in the wintertime. It's great. Before we get to the 6 human studies that are in here, let's look at the preclinical studies, because they're pretty fascinating about how this stuff works at the biochemical level. And I won't flash up every paper title because this is an open source paper. You can go and see all of these studies organized in nice table format. And also, if you want to learn more about the cannabinoid science each week, I have a newsletter on Substack called Cannabinoids and the People, also sponsored by CV Sciences, where I collect everything like this that comes out every week. So, in your mesenchymal stromal cells, those are a skin cell type that supports wound healing, CBD reduced their oxidative stress. In the keratinocytes, which is the human skin stem cells, your skin replaces itself every 30 days. It's those stem cells in a very tightly regulated process. In those keratinocytes and in the fibroblasts, which are connective tissue, CBD as well as cannabis extract lowered pro-inflammatory cytokine release and downregulated pro-inflammatory genes. You're going to hear anti-inflammatory and antioxidant over and over again. In skin stem cells, keratinocytes insulted by hydrogen peroxide, CBD reduced their oxidative stress and maintained their protein networks. Also, skin cells involved in the wound closure saw improved cell migration and faster wound closure when treated with THC or CBD. And finally, in the skin of mice, topical CBD treatment increased wound repair molecules. Now let's move on to our human studies, and none of these are gigantic studies, but they are very serious skin issues going on here, and it seems like everything else had been tried before these cannabinoids were tried. So I think these are very telling reports. So the first one is, in 3 case reports of people with epidermolysis bullosa, which is a very painful disease of easily blistering skin and easily blistering mucous membranes. If you see pictures of it, it's really terrible. And all of the people involved in this reported topical CBD to cause faster wound healing, less blistering, and more amelioration of pain, with one patient being able to stop completely their opioid painkillers. Also, relatedly, there is a survey of 71 patients with that same condition, and they reported that topical and oral preparations help them with pain, with itchiness, with wound healing, and overall disease symptoms, with 79% of the survey participants using less pain medications. So very telling. Then in 20 people with skin disorders that cause scarring, such as psoriasis or eczema, CBD topicals improved their skin parameters, reduced their symptoms, and lowered clinical scores. Then in 2 patients with painful non-healing ulcers of greater than 6-month duration from a disease called non-uremic calciphylaxis, the topical cannabinoid stopped the need for opioids within 2 months, and it closed the wounds completely in 2.5 months. Then, in one of the most convincing studies to me, in 14 patients with 16 challenging recalcitrant leg ulcers, as in very, very resistant to treatment, once they started using topical cannabinoids, 13 of those 16 wounds closed within an average time of 34 days. Then a case report of serendipity. There was a patient with a pressure ulcer, as in from laying in one place, and that was resistant to treatment for 5 years. Then this patient, she began oral THC CBD oil for sleep and pain, and it helped her sleep and pain, but it unexpectedly started healing her ulcer and within 2 weeks, and it completely closed it in 2 months after 5 years of nothing working. It's too bad that larger clinical trials haven't been done on this important topic, but these studies make clear that it makes sense to use both topical and oral cannabinoids for wound healing.